here's one of the pioneers. This is J. Harvey Kellogg. Him and his brother invented cornflakes. And he was absolute anti-masturbation crusader. And he wrote an entire book about masturbation. It's called Treatment of Self-Abuse and Its Effect, Plain Facts for the Old and Young. And in this book, he specifically said that if children are caught masturbating, that for boys, circumcision should be performed without any anesthetic, because the pain that's associated with the surgery will be a good reminder of them. Punishment will be associated with the procedure. So definitely don't use anesthetic, and make sure that it's directly linked to the fact that they were caught masturbating. And then for girls, he recommended applying carbolic acid to the clitoris, because he thought this was the best way to stop little girls from masturbating. And all this is, for the child's health, right? But very serious writings, very well-respected physician at the time. So as people started to question its effect on masturbation, what we see is a bunch of other a priori medical justifications starting to pop up. Well, if it's not good for masturbation, maybe it is good for this, or maybe it helps prevent this disease, maybe it prevents this disease. And I just want to show you some of the studies. These are all actual published medical studies in mainstream medical literature for the day. So in 1845, this physician said it cures masturbation. In 1855, it prevents syphilis. In 1865, it prevents epilepsy. 1870, spinal paralysis, bedwetting, scoliosis, paralysis of the bladder, clubfoot, nocturnal emissions, abdominal neuralgia. I like this one. It cures all eye problems. Not some of them, all of them, right? It cures all eye problems. Blindness, deafness, and dumbness. And this, of course, this is the best one. Circumcising blacks prevents them from raping white women. Okay? And if anyone would like to, pull out this little gem, here's the reference right there. You can get it out. This is an interesting article, and I would actually encourage you to read it. Other than being incredibly racist and unscientific and stupid, the article talks a lot about what they perceive as the anatomical susceptibility of blacks, why they always are raping these white women. And they say it's their foreskin. They say that the centers of lust are in the foreskin, and it seems to be overdeveloped in blacks. Therefore, that's why circumcision makes sense. But, they seem to place the blame entirely on this source of sexual pleasure, which is interesting. Rectal incontinence, tuberculosis, penile cancer, prostate cancer, venereal disease, cancer of the tongue, cervical cancer. What does the Canadian Pediatric Society say?